What are the best exercises for cubital tunnel syndrome? Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain what causes cubital tunnel syndrome and some exercises and other treatments that you can use to help get rid of cubital tunnel syndrome. Now, what is cubital tunnel syndrome? Cubital tunnel syndrome is an irritation of the ulnar nerve at the elbow. If you hit your funny bone on something, that causes an irritation of that ulnar nerve at the cubital tunnel. The ulnar nerve is really superficial on the inside of the elbow, and so it is subject to blunt force traumas like hitting your elbow. Or if you fall on an outstretched arm and have a fracture or dislocation of your elbow, that's an additional thing that can cause cubital tunnel syndrome. But it doesn't need to be a traumatic injury. You can get that from low load compressions, like sitting with the inside of your elbow on armrests for long periods of time. You can also get it where that ulnar nerve is stretched across the elbow if you have your arms flexed up like that when you're sleeping. That's a really common cause of cubital tunnel syndrome, is either overuse of muscles going into a really flexed position like that, say from working out or lifting things, working on a manual labor job, or just sleeping with your elbows flexed like that. And what that does is it stretches the ulnar nerve across the elbow at the cubital tunnel. Now, the ulnar nerve actually starts up in your neck, runs through your shoulder, down the inner arm, and into the forearm and the little two fingers of your hand. So the symptoms of cubital tunnel syndrome are often pain, numbness, or tingling in the forearm or the little two fingers of the hand. And so what do you do if you have cubital tunnel syndrome? Well, the main things are that you want to avoid those sustained elbow bending positions where you're sleeping with your arms like that for prolonged periods of time. Now, I know you can't 100% control what you do when you're asleep, and there are splints or braces that you can use for cubital tunnel syndrome that help keep your arm more straight like that when you're sleeping. They're not incredibly comfortable, so if you can get in the habit of just putting your arm out like that more when you're sleeping rather than having it curled up underneath of you, that's something that can be helpful. There are also braces or splints that you can use during the day that prevent you from getting all the way up into that elbow bending position. But again, they're not incredibly comfortable and they do interfere with your function a little bit. So if you can just avoid going into those elbow flexion positions as much as possible, that's probably the best option for it. Now, what about exercises that can help cubital tunnel syndrome? Well, the cubital tunnel the ulnar nerve is put on stretch when you're in a position like this. This position here is actually an ulnar nerve tension test, and it can help to diagnose or think that you might have an ulnar nerve problem. And when you put your ulnar nerve on tension where it's stretched across the shoulder, across the elbow, across the wrist, and across the fingers, it can give you the symptoms of pain, numbness, or tingling in the forearm or in the little two fingers. And if you have a positive test on that, that's a good indication that you may have an ulnar nerve problem. It's not always specific to the cubital tunnel, but it does indicate that you may have an ulnar nerve problem. And so doing portions of that test, not going fully into the tension position, but just going through the range that you can comfortably without provoking symptoms, is one good exercise for cubital tunnel syndrome. Another thing is that if you work out a lot, if you do a lot of bicep curls or a lot of tricep push downs, that can cause repetitive stress on your cubital tunnel. If you tend to do your push downs with palm down like that, when you get to that top range of the motion, that puts a lot of stress on the ulnar nerve at the elbow. Additionally, if you do reverse curls with your palms down like that, that can put the ulnar nerve on stress. So doing palm up curls and avoiding going all the way into the fully bent position. Additionally, using a reverse grip on your push downs or at least a neutral grip and avoiding going all the way up. Those are some good things you can do to prevent cubital tunnel problems when you're working out. Now, what other exercises can be helpful for cubital tunnel syndrome? Well, the wrist flexor muscles of your forearm come up and attach to the inner elbow. And if they're stiff, they can entrap the ulnar nerve in the musculature of the forearm. So doing wrist flexor stretches like that, where you stretch out the muscles of the forearm with your elbow straight. That can help improve the mobility of the ulnar nerve as it runs through those forearm muscles. Additionally, I mentioned that the ulnar nerve starts out at your neck. And so you want to rule out that the problem is not coming from your neck, or that there's at least not a contribution of, say, a C8 or a T1 radiculopathy that's causing some or all of your ulnar nerve symptoms. And we can help you do that in physical therapy at More for Life if you do need some help to figure out what's causing your symptoms. But some treatments you can do for the neck part of cubital tunnel syndrome, if it's present, is stretching your neck away to kind of help open up the spaces where those nerve roots come out. Or if you have an entrapment of the lower part of your brachial plexus here at the shoulder, say your first rib's too elevated, that can entrap the brachial plexus that the ulnar nerve comes off of. And that can also give you symptoms into the little two fingers of the hand. So doing a first rib mobilization with a strap or a belt over your shoulder like that and stretching away can be helpful. And I've got another video that explains that in a little bit more detail that I'll link out to. But you do want to rule out the neck and shoulder contributions to possible cubital tunnel syndrome, because if they're not the full cause of it, they can be related and make the ulnar nerve more sensitive along the cubital tunnel. Now, what other treatments can you do for cubital tunnel syndrome? Well, the last-ditch resort is a surgery where they move or transpose the ulnar nerve and decompress any pressure off of it. But a lot of times that can be avoided with good physical therapy. During physical therapy, we can do some treatments for the soft tissues around the ulnar nerve, both in the forearm, the upper arm, the shoulder, and the neck, to alleviate any areas of compression, to allow it to glide better as you go through your normal movements of daily life. We can help you to learn some of the provoking positions and activities during your life that may be making the problem worse. We can also use some hands-on treatments like trigger point therapy in the arm or instrument-assisted soft tissue mobilization to get the tissues around the ulnar nerve to move better. Or dry needling is another treatment that can be helpful, where you put little needles into the muscles to help loosen them up around the ulnar nerve. So there are a lot of good reasons to seek out help from a physical therapist if you do have symptoms of an ulnar nerve problem, particularly if you think you may have cubital tunnel syndrome. And if you happen to be in St. Louis, we'd be happy to help you out at More for Life. Just give us a call and we'll get you set up with an appointment with one of our therapists. And if you're watching this from somewhere else, contact a therapist near you and they can help you to find out what's causing your symptoms as well as to help you get rid of it. And no matter where you're watching this from, if you did find these tips helpful, give this video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.